Goodbye A cup, welcome C cup. 찰스 랑키스 선생님께서 이제 가슴 수술의 이제 유명하신 이유 중에 하나가 유두에서부터 밑선까지 거리를 이제 방정식으로 만들었다는 게, 그리고 이제 우리가 피타고라스 정리처럼 이제 방정식을 만드는 게 굉장히 유명하십니다. A lot of viewers will be wonder about your equation, how we design our nipple to IMF distance, and you also categorized whether we use texture type and smooth type. So, and when the patient have like soft tissue or tight soft tissue. So can you give us a short explanation about that?
So one of the very important things in breast surgery is how does the most beautiful breast look like? How does a perfect breast look like? What I've been saying from the very beginning, and I've been teaching on a fairly high level for many years around the world, is it's the balance between the width of the breast and the IMF fold. If you get that balance perfectly right, then the rest you can tailor tuck and arrange, and you can add or subtract volume, but you need to get that. So what I've done is I've followed my patients over time. So I've been measuring everything in the breast on the maximum stretch, and with all the numbers that I got together in combination in something that I believe in, the golden ratio and the Fibonacci curve, the relationship 1 to 1.618, I've been able to create an algorithm, a guideline. So with that planning, regardless if you go through the axilla, nipple areola, or under the IMF, you're able really to put that implant in a perfect position of that breast, which is the key.
Yeah.
Really. Because if the breast is too high up, the nipples look down and you have too much volume. If the breast implant is too low, of course, the nipples look up and it looks old and bottomed out. And that in combination, creating that perfect image, also understanding the difference between textured and smooth implants and how they act in the body.
So I think that your equation helped also me and other surgeons quite a bit. And I sometimes, if I get confused, I read your article again and see how my measurement was wrong or should be corrected.
And it's very simple. I mean, basically, it's for any surgeon who watches this that hasn't seen me lecture, it's basically with a textured device, you take the width, regardless if it's anatomical or round, and you subtract.
4 centimeters.
Yes, 4 centimeters. And if you really want to get into detail, if it's textured, 3.5, if it's smooth, it's 4 centimeters. But if you want to make it very simple, 4 centimeters, subtract and you'll be safe.
Yeah.
And this is based on math, and it works. Yeah. I've had thousands of surgeons using it, so it actually works.
Yeah.
And it's good.
What's your thinking about the future?
I think in general, we're striving to do less traumatic surgery in general, faster recoveries, shorter scars. Patients want to return to their work, to their lifestyle fast. So for me, where I predict a big part of the future will be with smooth devices. You know, I'm a big fan of anatomical texture devices,
sure.
and I can create beautiful results with them, and I do believe they play an important role in breast surgery. I think everyone should know how to use them. However, if we look at women in general, we have to ask ourselves, if breast augmentation was free and without any cost and absolutely safe, most women most likely would like to have a little bit bigger breasts.
Yes.
Would you agree?
Yeah, I'm agreeing too, yeah.
I'll be a little bit blunt here, and I don't want to come out rude, but I think the same would apply for men.
Yeah.
If all men could have a slightly bigger penis, and it would be for free and without any problems, most men would.
Yeah.
It's just one of those things emotionally. So if we can provide something that is safe, predictable, with less trauma, coming back to social events and lifestyle faster, I think that's where the future is.
Yeah, I think so too. People are struggling in their real life. They're kind of busy, even though all the machines are getting more convenient, but people are getting more busier.
Well, absolutely, and they expect it. So where I think this is going to go is we're going to use smaller, smooth devices that are very biocompatible, that doesn't create a risk for inflammatory reaction and cancer in the same way, because they want safety.
Yeah.
And I believe small because smooth in general has a disadvantage. If you go too big, you can't control where that implant goes over time.
Yeah.
So smaller implants, and then if they want to go bigger, combining it with fat transfer. And today I'm doing a lot of so-called high definition liposculpturing. I really shape the bodies and I take the fat. I don't throw it away. I use that fat, I put it in the face, I put it in the breast, I put it in the butt. I can put that fat anywhere. So putting it around that small implant, I think will be part also of that procedure. And I've been working for many years on a concept together with a company, and the concept is called MIA, minimal invasive augmentation. And it's a very quick procedure done under local anesthesia, going through the axilla, and basically within 10 minutes you have new breasts. And you can go back to your family life so much faster. So I believe combining concepts like that, small implants with safe surgery, because it's not really breast augmentation, it's a breast enhancement.
Yes.
Because all women do sometimes wear a push-up bra, but maybe want to go up 1 cup. So if that's a possibility, I think a lot of women would like to have that type of procedure.
Yeah,
so I foresee that's the future.
Yeah, I think so too. People want to have less aggressive, less traumatized, and more quick, more convenient, like well recovered. So I think that is the future. Yeah. I think a lot of surgeons agree with that.
I've had patients coming to me where I open up the breast and I see the heart.
Oh, wow.
I see the heart in front of me.